This is big breaking news coming in.
As the news spreads of China's mystery illness.
This morning, there have been 571 cases confirmed by the Chinese government.
Deeply concerned both by the alarming levels of spread and severity.
The conference today, they gave the virus a name, COVID-19.
Big day today, India crossing the 10 lakh mark.
आज रात 12 बजे से संपूर्ण लॉकडाउन होने जा रहा है.
The lockdown is hitting India's most vulnerable the hardest.
The worst public health crisis for a generation.
So during COVID, SELCO Foundation started responding to the need on the ground. And primarily when it comes to healthcare and medical services, there were 3 or 4 areas that were very prominent, where it was not only government that was falling short of ensuring that they can deliver good services, but also a lot of civil society and private sector that was struggling. Number 1 is to ensure that the immunization is sound, that the vaccine cold chains are actually secured. Number 2 was on the oxygen value chain. So this we faced across urban, rural, tribal areas where I think COVID just sort of made us realize the gaps that exist currently in the oxygen infrastructure. The third and most critical part was the infrastructure piece. So establishing new capacities, right from extension at PHCs to 10-bedded ICU units, and all of this with sort of the network of partners that we worked in the state.
यहाँ पे तो रूरल पे तो जो टीवी मीडिया से पूरे लोग बहुत डर रहे थे. इस समय स्वामी विवेकानंद यूथ मूवमेंट से जो हमें फील्ड वर्क और ऑफिस वर्क जो स्टाफ हैं वो तक फील्ड उतरे, वो अनाउंसमेंट करना गाड़ी से माइक में और डोर टू डोर जाने के बाद उनको समझाना और पॉम्पलेट इश्यू करना, ये सब भी बहुत किए. अस्पताल से कोई लोग गांव को गए तो वो मना कर रहे थे, आप अस्पताल से आ रहे हैं, आप इसके कोविड लेके आते हैं. वो सैंपल कलेक्शन करने तो बहुत मना कर रहे थे, फिर भी उनको मना के सैंपल कलेक्शन करना, उनको पॉजिटिव आया तो उनको कोविड सेंटर को रवाना करना, ये बहुत दिक्कत लगा.
During the second wave, it was a peak of second wave, and at that time we were managing around 21 government hospitals in the Bangalore urban taluk itself. So all the government hospitals were full. There were no beds for people, and there was a condition like we had to deny admission inside the hospital. This facility is called as Yelahanka COVID Care Facility. So it is situated in Yelahanka New Town, north of Bangalore. So this hospital was then constructed in a period of 21 days. The empty building was changed into a hospital within a period of 24 hours. The next day CM inaugurated it, and the day after the hospital was started for COVID, and we ran the show for around 90 days till the last patient of COVID was there here in Bangalore. Here we created 10 ICU beds, 20 HDU beds, which is nothing less than a ICU. It was high definition unit. So 20 HDU beds which were able to function as a complete ICU also, and 70 general wards. The roof which is placed over here, it is a double layered one with also non-heat transparent one, and also the walls. So with this, the heat problem was also solved, and also there is no rainwater seepage or anything as such present over here. Yeah, that is very innovative of SELCO team to come up in such a short period of time. One thing which is mandatory for all hospitals is they should have a secondary backup, and much hospitals will have a diesel generator backup. Since we are going green, we have solar backup itself, so we don't have a diesel generator itself. Solar will completely help us with the functioning of hospital.
ಈ ಸೋಲಾರ್ ಸೆಟಪ್ಪಿಂದ ಕಂಪ್ನಿ ನಮಗೆ ಗೌರ್ಮೆಂಟ್ ಇದ್ರ ಥ್ರೂ ಫ್ರೀಯಾಗಿ ಇದು ಮಾಡ್ತಾಯಿದೆ. ಅದರಿಂದ ನಮಗೆ ಭಾಳ ಉಪಯೋಗ ಆಗಿದೆ. ಒಂದಂದರೆ ನಮಗೆ ಪವರ್ ಸೇವ್ ಆಗ್ತಾಯಿದೆ. ಆಮೇಲೆ ಸೆಕೆಂಡ್ ಪಾಯಿಂಟ್ ಅಂದರೆ ಅನ್ಇಂಟರಪ್ಟೆಡ್ ಅವಾಗ ಕರೆಂಟ್ ಹೋದಾಗ ಭಾಳ ಪ್ರಾಬ್ಲಮ್ ಆಗ್ತಿತ್ತು ನಮಗೆ. ಸೊ ಸ್ವಲ್ಪ ಮಟ್ಟಿಗೆ ಬ್ಯಾಟ್ರಿ ಬ್ಯಾಕಪ್ ಇತ್ತು ನಮ್ಮ ಹತ್ರ, ಜನ್ರೇಟರ್ ಕನೆಕ್ಷನ್ ಇಲ್ಲ. ಸೊ ಹಂಗಾಗಿ ತೊಂದರೆ ಆಗ್ತಿತ್ತು. ಸೊ ಆ ಪ್ರಾಬ್ಲಮ್ಮು ಸಾಲ್ವ್ ಆಗಿದೆ ಇವಾಗ. ಇದರಿಂದ ಸೋಲಾರ್ ಪವರಿಂದ ಸಾಲ್ವ್ ಆಗಿದೆ. ಇದು RT-PCR ಲ್ಯಾಬಲ್ಲಿ PCR ಮೆಷಿನ್ಗಳು 3 ಇದ್ದಾವೆ. ಆಮೇಲೆ RNA ಎಕ್ಸ್ಟ್ರಾಕ್ಷನ್ ಮ್ಯಾನ್ಯುವಲ್ ಆ್ಯಂಡ್ ಆಟೋಮೇಟೆಡ್ ಇದೆ. ಸೊ ಅದಕ್ಕೂ ಪವರ್ ಬೇಕಾಗುತ್ತೆ. ಸೊ ACs ಇದ್ದಾವೆ, ಫ್ಯಾನ್ಸ್ ಇದೆ, ಟ್ಯೂಬ್ಲೈಟ್ಸ್ ಇದೆ. ಸೊ ಹಿಂಗಾಗಿ ಇದು ಕ್ಯಾಲ್ಕುಲೇಟ್ ಮಾಡಿ ಅವರು ಅದಕ್ಕೆ ತಕ್ಕಂಗೆ ನಮಗೆ ಇದು ಮಾಡಿಕೊಟ್ಟಿದ್ದಾರೆ. 335 ವ್ಯಾಟ್ಸ್ದು 30 ಪ್ಯಾನಲ್ಸ್ ಹಾಕಿದ್ದಾರೆ. ಆಮೇಲೆ 200 AH ಬ್ಯಾಟ್ರೀಸು 20 ಹಾಕಿದ್ದಾರೆ. ಸೊ ಇದರಿಂದ ಅದು ನಮ್ಮೆಲ್ಲ ಫುಲ್ ಲ್ಯಾಬ್ಗೆ ಸಫಿಷಿಯೆಂಟ್ ಇದೆ. ಇದು ಡೆಫಿನೆಟ್ಲಿ ಇಟ್ ಈಸ್ ವರ್ಕಿಂಗ್ ಆ್ಯಂಡ್ ಇಟ್ ಈಸ್ ಸ್ಮೂತ್ ಆ್ಯಂಡ್ ಅನ್ಇಂಟರಪ್ಟೆಡ್ ಇದು ಫೆಸಿಲಿಟಿ ಕೊಡ್ತಾ ಇದೆ. ಸೊ ಹಂಗಾಗಿ ಭಾಳಷ್ಟು ಪ್ರದೇಶಗಳಲ್ಲಿ ಈ ಥರದ್ದು ಮಾಡೋದು ಒಳ್ಳೆಯದು. ಅದರಿಂದ ಪವರ್ ಸೇವ್ ಆಗುತ್ತೆ, ಎಲೆಕ್ಟ್ರಿಸಿಟಿ ಸೇವ್ ಆಗುತ್ತೆ. ಸೊ ಸೋಲಾರ್ ಎನರ್ಜಿನ ನಾವು ಯೂಸ್ ಮಾಡ್ಕೋಬೋದು. ಸೊ ಹಂಗಾಗಿ ಮುಂದೆ ಏನಾದರೂ ಔಟ್ಬ್ರೇಕ್ ಜಾಸ್ತಿ ಆಯ್ತಂದರೆ ಇಟ್ ವಿಲ್ ಬಿ ವೆರಿ ಯೂಸ್ಫುಲ್.
ଆଉ ଏ ଆଶ୍ରୟସ୍ଥଳୀଟି 2017ରୁ ଆରମ୍ଭ ହୋଇଛି। ଆଉ 2019ରେ ଯେଉଁ କୋଭିଡ଼ ପିରିୟଡ଼ ହେଲା, କୋଭିଡ଼ ପିରିୟଡ଼ରେ ଏଠି କ୍ୱାରେଣ୍ଟାଇନ୍ କରିବା ପାଇଁ ଲୋକମାନଙ୍କୁ TMC ସେଣ୍ଟର କରାହେଇଥିଲା। ଆଉ ଏଠି ଲୋକମାନଙ୍କୁ 2020ରୁ 2021 ଯାଏଁ କ୍ୱାରେଣ୍ଟାଇନ୍ରେ ଲୋକମାନଙ୍କୁ ପୁରା ରଖାହେଇଥିଲା। ଯେଉଁମାନେ ବି ବାହାରୁ ମାଇଗ୍ରେଟେଡ୍ ପର୍ସନ୍ ଆସିଥିଲେ ତାଙ୍କୁ ଏଠି ଥଇଥାନ କରାହେଇଥିଲା। करंट का जो प्रॉब्लम है, सिचुएशन क्रिएट होता है, मतलब ये बारिश के सीज़न में जो फ्लड का प्रॉब्लम होता है, उसी टाइम लाइन ज़्यादा टाइम रहता नहीं है। एठी जो इलेक्ट्रिसिटी रो क्राइसिस थिला, जो प्रॉब्लम थिला, सेटा को सॉर्ट आउट करबा पई आम सेल्को फाउंडेशन तरफ एठी गोटे 2020 रे गोटे सोलार सिस्टम दिया गला, जोथि पई आम एठी जो रहउतले क्वारंटाइन रे लोक गुड़ाक आसिक से बहुत बेनिफिट पाइले। 24 घंटा आम ये इलेक्ट्रिसिटी फायदा पाई पार्लु। ये मोटर यूज होता है, लाइट यूज होता है, फैन यूज होता है, सब चलता है। इधर पूरा टोटल सिस्टम सोलर से चलता है। ये अंचलटा आमर जेहेतु नदी खंडी अच्छी, नदी एरिया रे अच्छी, फ्लड सिचुएसन सब लगी रहे। आउ से फ्लड सिचुएसन को आम प्रतिरोध करने तार मुकाबला करने आम ये फ्लड सेंटर तैयारी होती। जो मैंने फ्लड एफेक्टेड लोक आणिक फ्लड सेंटर रखिकी ए सेंटर रे आम ये पानी सुविधा अच्छी, लैट्रिन, यूरिनाल और खावाई आम भी पंचायत रू सब बंदोबस्त कराइला। ये जो लोक मैंने क्वारंटाइन रे थिले तांको पे पंचायत रू खावाई बंदोबस्त कराइला, समस्त खावाई दिया होता। ये समस्त जिनस ये जो फ्लड यहाँ जेहेतु मल्टीपर्पज फ्लड सेंटर, ये बन्या रू रक्षा करने जो जिनस गुड़ाक दरकार गवर्नमेंट तरफ सरकार तरफ सब जिनस दिखाई, जो जिनस गुड़ाक आम बन्या समय रे व्यवहार करके लोक उद्धार कर पारबो, लोक रिलीफ साहाय्य कर पारबो।
I'm Jacinda Shangjam. I'm a staff nurse in BHC Talui Primary Health Center. This primary health center is located in Talui, which is in Manipur State, Yukul District. This is a remote place. It is a small village with a large population. We have more than 4,000 plus population here. And this is the only health facility that we can provide them. And also not only this village, we have 6 more sub-center. Those sub-center, if they have like accident for labor purpose, they all are coming here for check-up. We used to face so many difficulties when there is no current. Like sometimes the current used to go away, and then we have some vaccine storage. So for that backup, we were not having anything. When there's no electricity, then we have nothing. We used to do with flashlight, mobile phone, and another all. So after SELCO cell, they provide us this battery, solar. It is very helpful to us, especially for the vaccine and sometimes for computer work, and also for the when we have some minor OT or some labor room work. After this solar and battery and all, after it came, we feel much better.
A lot of our efforts actually were quite restricted because of the lockdown itself. But we have very strong partners who are very grassroots. What we saw was that a lot of the ideation, facilitation, work on the ground with communities, with governments were very strongly facilitated through our partners itself. And that resulted in a lot of very unique solutions coming up on the ground. Swab collection in a van, vaccination happening through very innovative means of actively powered vaccine carrier systems.
हमें सिटी से बहुत दूर तक जा रहे थे, वो ट्राइबल एरिया हो, नॉन ट्राइबल एरिया हो। पहले तो हमें नॉर्मल वैक्सीन कैरियर ले जा रहे थे, वो लगभग 8 घंटा उसका काम चलता है। 8 घंटे भी तकलीफ है, लेकिन बार बार खोलना मूछना करे तो 4 से 5 घंटा आता है नॉर्मल वैक्सीन कैरियर। नया डिजिटल एमओएलयू आया, उससे थोड़ा हमारा काम आसान हो गया, क्योंकि वो सिंपल है, वो करेक्ट उसका आइडिया मालूम होगा तो उसको रन करना, चालू करना, यूज़ करना बहुत आसान है। वो 8 से 10 घंटे तक भी काम आएगा। वो सिंपल है, एक लोग बैग के जैसा कैरी कर सकते हैं, 2 व्हीलर में, साइकिल में, चल के 2 व्हीलर में, 4 व्हीलर में, कैसा भी उसको एक तरफ से और एक तरफ को बहुत आसान तरीके से ले जा सकते हैं।
This hospital is located in Dugailong village, Tamenglong, which is about 3 kilometers far away from the main town. During COVID times, this installation of solar is very much helpful to us, because lots of patients comes with the problems of breathing difficulties. So we use oxygen concentrator also. By this help of solar, we can help and we can save the life of the patient. Before installing this solar, we faced lots of problems, especially during attending the emergencies. And during emergencies like deliveries and all, with this manpower, we are very much, we face lots of problems to on the generator also. But after the installation of this solar, we solved all these problems, I can say. It's also decreased in purchasing the fuel also for the generator. There's 123 panels and 80 batteries for this whole hospital of District Hospital Tamenglong, and which is sufficient for us. This hospital is a 50-bedded hospital, and then we have ICU room, and we have dialysis, we have OTs, we have labs and all. With the help of this solar installation, we can run all these departments without any facing the problems of light.
So most of the centers that we established, which were infrastructure responses, have started being used for other purposes, and hopefully we don't face the peak again, but we are, hopefully more ready for a disaster in the future, given the expansion of infrastructure that has happened during COVID. One of the things that we have kept in mind for this is making sure that all of the infrastructure uses green building design principles, natural lighting, ventilation, sourced by local enterprises, keeping local materials in mind as well.